Start.
Okay. So, good afternoon to everybody, and welcome here to this webinar related to IN-4-AHA project. I must thanks to everyone for attending this meeting, and particularly for to the today's speakers. And I must tell you that is an honor for me to present the today's speakers for two big reasons, because they are my friends, Joseph, Javier, and also partners from some projects that are running, some European projects, and for instance, we are all, University of Porto is also partner of the SHAPES project. So it is a pleasure for me being here and being here presenting the today's speakers. The today's speakers, we're going to present their own projects and they experience on empowerment of senior or to in the empowerment of the senior population in terms of new technologies and digital solutions. So this is a big challenge for all of us, how we can put technology, digital solutions in the hands of this senior population. So thank you a lot for being here, and we can start right now because we are interested in a nice discussion in the hand. So the first speaker is Josep Fico. I must tell you that I work with Josep Fico during the last 12, no, 10 years.
Almost 10 years.
10 years, yes. So, and he comes to talk about the Gatekeeper project and about the technical solutions that she wants to go. So, Joseph,
Yes. So I guess
your
you can
experience with
see
us.
my screen, right?
Yeah, yeah.
Yes, perfect. So let me also thanks to you and say that Elisio and also all of you, many of you are friends, are colleagues. So we are in good, I like to be with you today and also with the new persons, happy to interact with you. We are friends, as Elisio said, but we became friends by working together in an initiative that you may know in the IN-4-AHA project because it's the EIP on AHA. The EIP on AHA, I'm a huge supporter from the very beginning, personally and also as a worker of my institution, Universidad Politécnica de Madrid. So because it was and that has been an occasion to really establish networks that were not established before with the normal, type of projects that we have. So I'm going to talk about the Gatekeeper project, but also some introduction in these minutes about where we are coming from and why we are we are choosing several type of solutions to empower older adults. Here you can also see that where I come from. I work in University of Madrid and I work in particular in the research group Life Supporting Technologies, but I'm also partner and active persons, I would say, with Elisio and others in the A1 group on the adherence to treatment. And also I was in charge of the empowerment actually within that group in the IPONACA, part of the Madrid 4-star reference site, but also other organizations that has been relevant and that are relevant for the things that I'm going to say, like the IoTI, where the large-scale pilots were also coming from in terms of requirements, reports, and elements, and also as biomedical engineering, part of the European Alliance of Biomedical Engineering, and I'm now the Secretary General. That decade, Elisio and dear friends, was the 2020 decade. So we are now in a new decade. We all know, and also there is a global issue on how we are facing the new challenges for this decade. So you may see here relevant initiatives that are put in place worldwide. This is the decade of healthy aging, and also how there are reports that are telling us how the SDG, which SDG in particular are related to aging, and also which are the specific elements that we have to consider worldwide. So these are coming from the WHO. In parallel, also, there has been some other important initiatives, and myself with other colleagues from my research group has been part of this initiative that I'm showing here. You may know the WIPO is another important organization that has just published a trend on assistive technology. So this is an available document, and that I really suggest you all to go through, because it's analyzing the trends of technologies and how, in which direction they are going in assistive technology. What is important to mention, I'm not asking you to read, but just telling you that while before, so in blue, there were technologies that were more vertical and segmented. Here, if you notice just here, but this applies also for the other, for the environment, they are referring to smart homes, smart cities, and assistive robots, meaning that the technologies and the patenting, the patents that are coming in the next years are integrated. So we are talking about integrated solutions. So not the single solution for one single problem, but smart homes and smart cities. So more integration is needed. And this is what we did in the Active Age project, which has been the first series of large-scale pilot in our sector. So Gatekeeper is keeping the coordination team of the same project and some partners. So the legacy is clear. And what was important to understand after 4 years of large-scale pilot and working together is that at the end, we are creating the conditions to enable these persons to share their data and to receiving back solutions that are important for their real problems. We have also created an association, the Activation.org, to keep the legacy and the experience, also to really create this market in Europe for active and healthy aging. And actually, in other words, this is what we have been discovering in our Activate project. I produce my data, do whatever is needed in terms of technology, service provision barriers, policy barriers, do whatever is needed to create a virtuous cycle of co-creation and give me, in change of my data, the services that are relevant for me. In the Activate, we identified several use cases, and actually we are now finalizing the exploitation of the data in also what we call the Activate public evidence website. And also we have defined from a business perspective tools that would allow persons to guide themselves and also the other stakeholders in selecting the proper technologies depending on the problem and the service that they need to be provided. So integration of services that are brand agnostic. This was something very important. We are publishing the results in terms of also of recommendations for designers, for older adults, and for all the other stakeholders, for elements that are needed in order to create solutions that are really mattering for our population. And also another important element was and has been taken from the IN-4-AHA to really assess the effectiveness of our solutions in using the triple win strategy of the IN-4-AHA. So quality of life, sustainability of healthcare system, and economical growth. So these are the things that very soon we aim to provide throughout this year after the first publication will take place. Now, this has been the evolution. Now we are part of a new era in these new decades where new projects like the Gatekeeper and others that we are seeing today are collaborating in the new era of this type of project. So it is clear that we are in the era of the health data spaces. You all know the European Health Data Spaces Initiative, and Gatekeeper is part of this context. So this project is taking the legacy from the Activate project. So we have increased our ambition from 10,000, we want to go to 50, 40,000. It's not a symbolic number, it's because we think that we need to create a new proactive environment where people can bring their own technologies. And our platform, our challenge is to allow this type of technologies to be integrated in our ecosystem. We have healthcare systems. They are all reference sites. So another important link with the IN-4-AHA. But why? Because we wanted to have all the conditions to maximize the success of our innovation. And the reference sites are exactly have been created for that. So the goal is to build this very big ecosystem. I tell you, 9 regional healthcare system plus 3 from Asia, Hong Kong, Singapore, and Taiwan. We have taken as a alliance pilot for synergic activities. You know how Asia is advancing in terms of technology for active and healthy aging. So we want to build a platform that enables the creation of a new generation of services based on data, based on artificial intelligence for early risk detection of chronic diseases. So our platform, I'm not going to talk about the platform today, so no technological detail, but is putting together all the elements that are needed in order to create data exchanges across different type of actors. So we have the symbolically called the healthcare space, where all the innovation coming from the healthcare sector are taking place, but also the consumer space. What happens when I am outside the healthcare system boundaries? So these are the elements that we are putting in place. When we talk about co-creation, it's an ecosystem co-creation. It's not only a matter of co-creating with the beneficiary of the end users, but with all the ecosystem. So we are addressing relevant conditions that are relevant and prevalent for older adults, but from the very beginning of the project, we have also added new ones. We have a specific use case, reference use case on COVID, and another on high blood pressure. But the idea is to really create a federation of randomized control trial to demonstrate the effectiveness of our solutions. And what is relevant for this topic today is that we are not only talking about needs and requirements, but we are talking about value. We are using methods from social science and responsible research to really understand all the elements that are needed in order to achieve our objective. And the value, the definition and the monitoring of value is going to be very important. Maybe in the questions and answer, I'm going to give more details on that. We are measuring our results in terms of cost effectiveness analysis using the MAFET tool that you all know, but also taking profit of other elements that we are taking from the IN-4-AHA, like the twinnings that we are going to use as a further instrument in addition to open calls that we are funding newcomers, whether they are technological provider or service providers. But the twinning instrument is something that we are going to use in this second part of the project. And the idea is to use all these instruments to really transform solutions that are valuable for our stakeholders in something that with standard certification activity and also procurement can be sustainable over time. We are also aware, that's why I mentioned the AMBES, that since 2 days, we are now in the MDR era. The MDR is already a reality. So we know how technology are evolving. So we like to say that there is a tsunami of new technological devices that is coming in our market. And therefore, we need to think how to conceive our ecosystem of solution for our older adults. So I leave you with this last slide. And our approach is to be really open in our project. So it's a real open, we are really using open innovation approach in all the different dimensions to really achieve that overarching objective that I told you at the beginning, and provide solutions that are really relevant for the persons whose data is used for something that is valuable for them, but also for our entire community. So these are the things that I would like to share today, and eventually later we can discuss on whatever you think is appropriate. Thank you.
Thanks a lot, Giuseppe. What we in the hand, we will have questions, but only in the hand. Okay. So now I will ask to Niam Redmond, that comes from Shapes project. Niam.
Hello, everyone. Can you hear me okay?
Yeah, very well.
Okay, great. Just let me set up here now. Okay, so good afternoon, everyone. My name is Niamh Redmond, and I'm here today to present on the Shapes project. It's a pleasure to be here with you all, and I look forward to the Q&A after the presentations. So Shapes is smart and healthy aging through people engaging in supportive systems. Shapes is an innovation action that intends to build, pilot, and deploy a large-scale EU standardized open platform. We intend to integrate a broad range of technological, organizational, clinical, educational, and societal solutions that seek to facilitate long-term healthy and active aging and the maintenance of a high quality standard of life. So Shapes kicked off in November 2019 and will run until October 2023. There's really two facets to the presentation today. One is in terms of the sustainability of the project long-term, and then one is on the co-creation aspect with end users themselves. But in terms of the sustainability and, you know, the adoption of Shapes, there's four main cornerstones to this. So one is the technologies themselves. Okay, so that includes assistive robots, e-health sensors, wearables, IoT enabled devices, and mobile applications. And then just as Giuseppe said, and you know, it's about the ecosystem as a large. So a network of relevant users and key stakeholders working together to scale up the platform and the digital solutions. And then importantly, we have the marketplace, which is a complete work package in Shapes that seeks to connect demand and supply across health and care delivery and to facilitate the co-creation of affordable, effective and trustworthy solutions. And then lastly, towards the end of the project, we will produce the Shapes recommendations that will provide guidelines, a roadmap and an action plan, including a set of priorities dedicated to standardization to support key EU stakeholders to foster the large-scale deployment and adoption of digital solutions and new integrated care services in Europe. So the consortium is led by ourselves here in Maynooth University at the Assisting Living and Learning Institute. We have 36 partners across 14 EU countries, and we plan to engage over 2,000 older individuals across the project in 15 pilot sites. The Shapes, the consortium includes 8 reference sites of the EIP on active and healthy aging and involves hundreds of key stakeholders to bring forth these solutions. So this is just a little overview of the consortium partners. You can see here on the left-hand side, just the geographical locations. And if I draw your attention just to the gold label sites, they are the pilot sites. So predominantly we have partners that are SMEs, followed by universities, NGOs, public sector bodies, and research and technology organizations. We have 10 main work packages. I don't want to get into this too much. I'll discuss it slightly later on. But you can see here really that our pilot campaign is the backbone of this project. So really where we test the digital solutions, test the platform, and figure out what works and what doesn't work for our end users. So just to briefly kind of illustrate the road to our pilots, we have a dedicated work package to understanding older individuals, their lives context, addressing as well as age-friendly, social, and importantly, accessible pathways and empowerment. And this work package also develops our personas, scenarios, and use cases for the platform. And then similar to what Giuseppe had mentioned in his presentation, it's very important that we examine the socio-technical ecosystems across these EU states, and more so on a national and regional level, and that we validate the socio-technical health and care models in work package 3. And this really identifies the user-centered organizational and operational requirements to make sure that Shapes can adapt to these locations, and it ensures the sustainability of the platform. And then, of course, the work packages 4 and 5 are based around the technologies themselves. And the technological platform is adapted in work package 4, which establishes the core functionalities, security elements, and interoperability requirements, enabling these digital services to interconnect, exchange information, and explore new capabilities. And so all of this collaborative work really then feeds into the end goal of the pilots, but is of course overseen importantly by a full work package on ethics, privacy, legal, and human rights protection. Sorry. So this is just to give you a brief overview of some of the technologies that we will be piloting. So we have, for instance, conversational assistants and chatbots, multimodal biometrics, face and emotion recognition. We have online communication and accessibility tools, predictive modeling, health and well-being platforms, cognitive stimulation and rehabilitation solutions. We also have robotics and clinical decision support systems that are mostly centered around healthcare professionals. And so these technologies will then be piloted across 7 main themes. So if I start from the left here, we have smart living environment for healthy aging at home. We have improving in-home and community-based care. And an important point about Shapes is that we are not really focused on people staying within their homes and using technology. We want to use this platform to enable older people to continue living in their communities and socializing in their communities, ideally in a post-pandemic world where we can begin to socialize in person again. We also have a pilot team centered around caring for older individuals with neurodegenerative diseases, and this is aimed predominantly at informal and formal caregivers. We have physical rehabilitation at home, cross-border health data exchange supporting mobility and accessibility for older individuals. Again, this one is slightly delayed due to public health restrictions. We have psychosocial and cognitive stimulation promoting well-being. And then lastly, medicine control and optimization. So I spoke a bit earlier about the cornerstone in terms of sustainability of the project. This slide is mostly just to demonstrate the process of engaging end users and our co-design process. So I'll just go through the speech bubbles briefly, and really what we ask are, what are the needs of the Shapes users? So this comes back to the work in work package 2 and 3, really conducting ethnographic research, a lot of social science research to examine what the needs of our end users are, and also being able to adapt. I think now people are referring to it as a digital bounce after COVID, where, at the beginning of the project, the digital literacy of our end users might have been relatively limited, whereas in this past year, they have been using technology a lot more and are much more engaged in technology. So this feeds into how can Shapes help? So what requirements do we need to have in place in our platform and our technologies to help these end users fulfill their needs? And then really we go into the pilot phase then, and we figure out, where does Shapes work? So this comes back to the socio-technical analysis. We then introduce via mock-ups and prototypes these solutions to the older people and ask them what their first impressions are. We take on that feedback and we adapt the solutions based on these results. Then we perform hands-on experiments, which really is just asking the question, what do you think about this solution? Is it helpful in your everyday life? Is it more of a hindrance in your everyday life? And collect that feedback again and reinterpret that with our engineers and technology providers. Once that is done and they are adapted once again, we then roll out the small scale deployment, and we basically can confirm then, is everything working as it should? So is the platform working? Are the digital solutions working? Are the analytics working correctly? And then finally, once that is confirmed, we then deploy it across all of the 15 European sites. And we ask the fundamental question of Shapes is, will it improve the daily health and well-being of older people? So I'll just go through the expected impacts. We expect to have a European-led platform for smart, healthy and independent living at home, to increase the competitiveness of the European ICT industry through enhanced interoperability, best practices and financing models in scalable markets, to create links and synergies between member states and regional initiatives, to improve the evidence-based efficiency of health and care systems with the demonstrated added value of the underlying technologies. Of course, to improve the quality of life and health for involved users and carers, again, with demonstrated added value of the tech. And lastly, a user-centered, validated and innovative solutions addressing accessibility, privacy, security, vulnerability, liability and trust in connected data spaces. And that is all from me. Thank you very much for your attention, and I look forward to the Q&A after this.
Thanks a lot, Lian, for your presentation and for sharing with us this information. And now it's time for Javier Gonzalez. I couldn't pronounce, sorry, Javier. It's a pleasure to have you here. And as Joseph, I know Javier 10 years ago, so it's a pleasure to have you here.
Just one
Javier.
thing, I'm going to be sharing Javier's presentation, okay, so we can have a bit more of a light approach to the internet connection. I think Javier is struggling a bit maybe with the internet connection, so I'm going to be sharing the presentation. Javier, as soon as you want me to change the slide, just
yes, I will let you know. Thank you very much. Thank you very much, Elise and Claudio, for this very nice introduction, and also for inviting me to present Academia, our projects and initiatives. Thank you very much. Very briefly, I am representing Academy, which is an academy on age-friendly environments in Europe. This is an SME based in Gouda that in year 2017, already 4 years now, Willeke van Staldaunen, whom many of you might already know, together with me, founded, as I said, in 2017. Willeke is very well experienced in politics and health, and from my side, I have background in ICT and healthy aging. These are the two co-founders, and we also count with the contributions and collaborations of many older adults and different professionals that support us in the different projects that we are running currently. What is the mission of Academy? Well, our mission is to support and increase the capacity of different types of stakeholders at different levels, at regional, local, community, even international level. What for? To design, implement, and monitor smart, healthy, age-friendly environments, but also, not only, but also practices, policies, places, and programs. This is our main mission. Next slide, please. And as I said, this is a roadmap of what we have been already developing since 4 years. Many, or we have been very, very happy to be committed to many initiatives and projects that we have initiated, are coordinating or participating in those. At the very beginning, already in year 2018, we initiated together with Karina Dantas, whom I will also mention later, the thematic network on smart, healthy, age-friendly environments. And as you can see here, we are running right now many different projects, which I will very briefly just present 2 or 3 of them. And last year, we also started this very interesting, amazing cost action, Net for Age Friendly, which is an international interdisciplinary network on SHAF. Next slide, please. Very briefly explained, well, SHAFE is focused on people, but or not only on people, but also on places. And because many of these have different challenges and needs, we understand that addressing those challenges needs to follow a holistic approach, in order to offer healthy solutions, appropriate smart technology to address social challenges and needs, and also to build proper environments. With all these things putting and coordinated and concerted together, we are then able to provide more independent living, better participation in society, and more healthy and well-being for people of all ages as they age. Thank you very much. And next slide. I already mentioned it before a little bit. So in year 2017, the concept of SHAFE was created by Karina Dantas from Shine to Europe and Caritas Diocesana de Coimbra in Portugal, together with Willeke van Staldaunen. Then in year 2018, we ran a thematic network on SHAFE. And this was very successful already. So we counted with the support of many, many stakeholders. That was so successful that the European Commission, during the presentation at the final event, they requested us to run a network. And this is what we did. We tried a couple of times, but last year we managed to get a cost action, which is called Net for Age Friendly. And at the moment, it already counts with over 170 partner organizations and over 300 researchers. Yes, This is an amazing thing when you take into account the one that we just started as a couple of months ago. Well, a couple in German. In English, it means different. I think something like 5 months or 6 months, and already 4 spin-off projects have been initiated. So this is a very interesting concept for all. Academy, we as such, we are running different projects where we perform development of curriculum, develop training materials and e-learning solutions. We perform research. We do also perform networking activities. We also make recommendations and advices to policy level or at policy level, and we also coordinate, in some cases, some of these projects. So this is the different kind of roles that we perform within our projects. Yeah. So here we present you a set of the projects we are currently performing, and I will concentrate now just very briefly in 2 or 3 of them. Concretely, at the very top, you have Bridge the Gap. Yes, and this is for training older adults to learn to improve their physical or social living environment by applying traditional and also digital tools. For example, advocacy by using social media, home technology. They can also, or how taking pictures and sharing them with policymakers and media can make a change in their environments. I would also like to mention to you another very interesting example. This is Dreamlike Neighborhood. It's at the left in the center. Yeah, there we are training facilitators and older adults to create networks in their neighborhoods and to support each other. This is also a very interesting topic. In all of them, these are Erasmus Plus projects, and in all of them we develop curriculum and group methodologies are available at the end of the projects for free. This is one of the conditions from Erasmus Plus, and we are very happy to do that. So, this can be taken up by also by other partners or the community themselves. So these are 2 projects. I also would like to mention very briefly Platform Uptake, which is a coordination and support action to create open online information hub on active and healthy aging. And this started in January last year. And last but not least, I already mentioned briefly Net4Age Friendly, the cost action, which is working to achieve cooperation and implementation, better cooperation and implementation of SHAFE environments with recommendations that aim to promote SHAFE concretely for all citizens and of all ages, and with the support of ICT tools. These are the couple of projects I would briefly like to mention to you. Next slide, please. I think this is it. Of course, we are always looking for cooperation with all and each of you. And in the next slide, you will also get our contact details. And I am very, very happy already to listen to your comments and feedback and to have some discussion on this topic. Thank you very much again for the invitation, and thank you very much for your attention.
Thank you, Javier. Now it's time for discussion. The discussion will be first moderated by 3 persons that come from IN-4-AHA project. Firstly, they're going to do some questions, and after that we will open to questions to all people that are attending. So now I give the floor to Gisela Garcia Alvarez, which is Managing Director of Cluster Saúde Galicia, Kaija Vilman, Project Manager at Schenck, and Claudio Santos here from University of Porto. So the floor is yours.
Okay, thanks a lot, Elisio. So from our side, I have a few questions. I'm going to pose these questions first. I know Kaija and Giselle, they also have one or two questions. I'm also going to say that for Shapes project, we're also going to be joined by William Malloy and Ron O'Sullivan. So if there's anything they want to add into some of these answers, please do so. Just to kick it off right away, We do have 3 initiatives here that are very different. They're somewhat different in their purpose, and they each deal with different sides of this technology adoption dilemma and challenge. So I know that Gatekeeper in Shapes, a lot of it is about creating new conditions, initiatives, so that you can actually develop technology, so you can actually develop new solutions. From your side, what do you expect, or what have you observed to be like the biggest barrier for these solutions to reach the market, to reach the user? So what do you think is the biggest challenge right now?
Thank you, Claudio, for the question. I can tell you that maybe the biggest challenge is what I said, I tried to say at the beginning, and it's how we are really taking into account the values that are related with the problems we want to solve. And for doing that, we recruited in our consortium, and actually is the work package leader, Alex Payne, Professor Alex Payne from Utrecht. And that group was in charge of the Neighborhood of the Future initiative. I don't know if you remember that initiative. That was very interesting because they organized several workshop, roadshow, they call them, to really put several stakeholders all together. And some of them are stakeholders that are not usually, interacting properly, or I would say, and trying to understand how we can capture value. Value means that we are trying to use the social science and the responsible research innovation approach to understand, to be aware the fact that values is something that is changing in the future, is very dynamic. And also what the technology that we are building today, are we sure that is not harming our end users in 10 years? You know, when it comes to digital health or digital, the digital era, there has been experience and cases. I'm sure that you are also teaching that in your, for those that are teaching ethics part in your university, that you really need to understand the consequence. And maybe sometimes we are not doing that, or we were not doing that properly. So I'm very happy that now we are obliged in our project in our research and Horizon Europe, it will be even stronger to include this part. So trying to understand how to capture value and how they are changing and how they are different depending on the context. If I'm asking for the quality of life, the answer may be different in different part of the world, not even Europe. So the conception of values is changing. So for doing that, and I conclude, Claudio, we have created a work package, the typical work package where you do the co-creation, the requirements, and so forth. We have added 2-3 layers where we are capturing values. We are doing the open calls as part of the co-creation. So open calls is not an administrative instrument, but is part of the co-creation that, together with other tasks, to really define all the stakeholders, have to put all the things together. So these are the, maybe my answer is too high level, but really we need this type of perspective. Then there are tens, hundreds of details that I can provide you, and more details. But the overall perspective for me, after all the experience that we have also from the previous large-scale pilot, is this is going to eventually make the change.
Okay, thank you, Giuseppe. I don't know if Niam or any other members of the Shapes project, if you want to add something.
Yes, just maybe slightly to add on what Giuseppe said with regards to something we struggle with now, I think, in a lot of these projects is for the beginning anyway, for Shapes, the focus is really on the data protection and data security, which is vital for each, for each of these projects. But now as we progress through the project, it is weighing up how you protect and secure data, but also how you can share as much data as possible in a safe way for that, so that we can share data among these European partners and make sure that the information we are collecting can really go somewhere and inform policy and inform better healthcare for our users. So that is definitely something that we constantly discuss in Shapes. I suppose another thing is that we want Shapes to be viewed as a proactive initiative. We do not want to associate platforms like this with, to equate being an older person with being ill. We are continuously, we're not just looking at people, say 80 plus as an older person, we're looking at older people now, people who are aging right now. So, 40, 50 plus. And how we can adapt our platform and our project to suit the needs of these people as we continue to age. Another thing to consider is equity and accessibility for every end user. So we have, as I said in my presentation, we have a dedicated work package. It's something we discussed in the cluster projects as well. How do we make sure that everyone has access to these solutions on these platforms? We have integrated 2 partners into the Shapes consortium, mainly for advocacy reasons and to ensure as we progress, we remain accessible. So we have the World Federation of the Deaf Blind included, and we also have the European Union of the Deaf to really consult with on a wide basis across the life cycle. And then I suppose lastly, because I'm sorry, I'm taking up some time, we want to make sure specifically for the healthcare professionals at the end of the day, that this is not considered an additional demand. These platforms and solutions are not another demand on their time, that they really are interpreted as solutions to help them perform their roles better and more effectively. So that's just for me, sorry.
No problem, Liam. Thanks for your contribution. I think you actually set up kind of a follow-up because from Javier's side, I mean, Shapes and Gatekeeper, your focus also on technological platforms and open calls. And I think Academy has a lot of projects, a lot of different projects, but a lot of it is related with the adoption part, with approaching the user and the technology. So what is the gap there? What is missing maybe from that side, Javier?
Very interesting. Thank you very much, Claudio, for this question. Well, throughout the different projects where we are involved, we see that players and sectors like ICT, not only ICT, yeah, we also have building industry, urban planning, we also have the health and social care, we also have, of course, the citizens and their communities, and these all types of stakeholders are key, and their different challenges are also in one way or the other interlinked, yeah. So and taking this into account, and taking into account that ICT or digital solutions are not a panacea to all the societal challenges, but when considering ICT or the digital tools as a powerful tool, we can be then very supportive to people of all ages and all the different types of players. Therefore, we as Academy, we are convinced that when considering these challenges and tackling them in a kind of coordinated or concerted way, then we can have the chance to develop to develop and implement adequate solutions that can be adopted by the different stakeholders types across Europe. And the former colleague from Shapes, she mentioned sustainability, etc. Well, we also have to make sure that the solutions are meaningful to the people, affordable, accessible, not only in terms of accessibility, digital accessibility, but you can go to a shop and buy it, etc. Yeah, we also see that responding to the challenges following, we have seen all these challenges are interlinked. Yeah, so we see that a holistic approach needs to be followed. Yeah, and such a holistic approach will foster the awareness and the awareness and the support for the creation, implementation, and further knowledge across Europe. Yeah, this is very, very needed of all these smart, healthy, and age-friendly environments. But not only for the current generations, but also for the future. So this kind of sustainability is also very important. This environments will enable the people to learn, will enable the people to grow and work and socialize and enjoy a healthy and more independent life. Yeah, they will be able to benefit from the usage of digital innovations. And as I mentioned, such innovations shall be accessible, sustainable, reachable, meaningful, and the support models need also to be adaptable to the changes of society as a whole, but the individual changes and as the people age, for instance. Yeah, and this is very important to take a look at it at the European context, not only at national or regional context. This would be, from my side, what is missing, yeah, to understand that all these challenges are interlinked, that a holistic approach is needed in order to give a coordinated answer to all these interlinked challenges.
Yes, and I'm just going to add, and this is my second question, then I'll pass over to Gisela or Kaija if they want to have other questions. But for me, as we're talking about senior empowerment, as we've been talking also throughout the presentations, it seems like we necessarily need to have users involved. So users need to be a part of the process, need to be a part of designing these solutions. And this concern, how and to what extent does this exist in your current processes, in your current projects? So I would even start with you, Javier, because I think we're kind of flowing through this. And then, of course, Shapes and Gatekeeper Project, please, if you want to add something, comment on this.
Okay, thank you very much again. Well, in our case, empowerment is of course very, very needed, and but not only empowerment, but also the participation of people and organizations at grassroots level, but also non-profit organizations. This is very important. But not only their involvement, yeah, we also need to take into account the previous steps or of their participation. We need to facilitate them. So we need to make them feel that they are valuable, yeah,
they have ownership on it as well.
Their ownership, not only of the solution, but even on their whole experience. They have a huge current and former work experience and knowledge and experience that they can share with the problems, yeah. And by building this capacity to participate at the different stages of the projects or initiatives of co-creation, this is very needed. And of course, we also have to show them to make their own voices heard. Yeah, not everybody can do that. So we can also empower them to do that. And here, for instance, a broader national and European support is needed to build and grow such ecosystems as we are mentioning. By providing training and coaching for their development. We see a huge connection, for instance, with Erasmus Plus programs, where all the outcomes shall be made available publicly. Yeah, and we also need further support in financial support to involve, for instance, people with lower opportunities and less who are less connected. You know, very often we present the projects at a certain level and they are accepted, but the ideation step or stage has already taken place. Yeah, so are we really involving people during the proposal writing? No, not always. We have short time. So this is also, I'm talking about even previous phases. Yeah, so when talking about participation, we also need to consider that a holistic and human-centered design approach, yeah, is not only intended for ICT development, but also for this shaft environments development, for political policy making level and funding, etc. Yeah, so we have still many things to do. Yeah, we mentioned we are human-centered, or we are co-creating, etc. But the ideation of all the solutions is already being taken by some thinking heads. Well, most of us are perhaps belonging to that group, well done, but we still need to broaden our scope and to collaborate also at that stage. And for that, we also need other ways of funding. Yeah. Also, how do you involve all the people, individuals in projects? We can only involve registered organizations. So how can, is it possible if the program changes just suddenly to say, well, I need that a new organization to get involved? This might be still a little bit complex in the current project structure. Perhaps with Horizon, I don't know it yet in detail, might be a little bit easier, but we also need to be able to collaborate with individuals at a certain stage of the projects and even the ideation process. Sorry if I was talking too long.
No problem, no problem. Giuseppe, Niam, or other members of these projects, do you want to add something about this importance of co-creation?
Yes, if I may, I try to be short, but I really was enjoying Javier answer. Maybe the word that synthesizes another element that I would like to add is living lab. So a living lab approach has been and is being fundamental in our all our actions. And we have been coordinating the living lab within the active health within my group, so we have also some experience of that. Even was more focused on startups, but for the entire ecosystem approach that we need for this type of initiatives, if we want to make a real impact, there is one definition of living lab that I don't like, formal definition. I'm not very good in that. But basically, one good definition of living lab is that put all the stakeholders that are needed for your innovation. Many times we start with the technological push, but then it's a service. It is always a service and process innovation, what we are doing in health and social care. And I agree with Maddalena, for instance, she's talking about organizational changes. This is very, very important because it's about whatever we want to do, it's always about the service and process innovation. So we need to educate all the people to change if is needed to change the process. And for doing that, the living lab approach is fundamental because only bringing all the stakeholders, so pay attention to this sentence, it's trivial, but it's not that trivial. Identify all the stakeholders that you need and try to see the role that they have is fundamental. For instance, in the ActiveAge project in Madrid, we were running a pilot in Madrid. We have created the Sustainable Living Lab, which was starting from our smart house, which is an infrastructure that we have in our lab. But now it's the entire city of Madrid that we want to use as living lab. So that's why the IN-4-AHA and the reference site network is important. As we like to say with the Maddalena, all the reference sites are living labs. So there is this strong relation. And then Javier, we did that during the proposal writing. And again, I mentioned Maddalena because she invited me to an event when I was drafting the Gatekeeper proposal, and that event that she organized in Naples, in the hospital Policlinico di Napoli, there was an event where the hospital was inviting all the population to do some check about their health status. And I realized how people were proactive in going there because they know that there is the healthcare system that is supporting you. Well, that gave me the idea of why we have to achieve 50,000 and not 10,000 in Gatekeeper. Because we want to establish a proactive approach where people can come to you if you put the real condition, and therefore you can create for real with these persons to do whatever you want.
Okay, thank you, Giuseppe. Niam, do you want to add something, or other colleague from Shapes?
No, please go ahead with the Q&A if you like. I know we're short on time.
Okay. So also, I don't know if Gisela or Kaya, if you want to add something or another question before we move on to the Q&A with the audience.
I don't know if Kaya, you want to add about the questions we have on? If not, I can jump as a Spanish probably one.
Of course, we can jump and go Q&A if the audience has questions.
We can also go for one audience question, and then if we have some time, we can put in another one. Or I mean, this is also very free flowing, so no problem there.
If I can add just a comment, maybe not so much a question. For Kaya was we were preparing questions, but I think being the last is always somebody steps on the question and answers partially. but that's fine. That's perfect. It means the questions were good. But we were also wanting to ask the barriers and facilitators of creating these open calls. We are creating, in fact, Champ was the leading an open call specifically on Living Lab. So, and what Giuseppe was saying was exactly what I had in mind, like all the stakeholders. And we also, maybe an answer to Javier would be that a way to involve users, like end users. In this case, we are being able to do it in IN-4-AHA by two ways, I would say. This kind of webinars, I think they're very good in also involving people at the different stage, but nevertheless creating this consciousness of Horizon 2020 or other European projects. But in our case, being a cluster or any type of entity similar to that, we have the direct contact with regulators and also patient association and other type of users, family, formal and informal caregivers, etc. And in our Living Labs, our users are precisely end users and family members, etc. So I think there's somebody in a busy street. So I think that actually covers a bit, maybe not perfectly, the inclusion of all stakeholders. For us, I think one of the barriers, and I would like to share with you, is it's important also that all these stakeholders are only, to go a bit deeper, they're not only users, the technology part, the regulators, etc., but also specific profiles that are able to translate what the companies are trying to implement and the real need of the people and how their adoption will be easier. And this, I still find that despite Living Labs, so okay, you do the testing and you see if it's better adoption, whether it's patient-centered care or not, etc. We need these translators, these technological people that are able, or somebody, not technological specifically, that are able to translate the needs, the results of focus groups, etc., with how that, because the key point also of a Living Lab and testing for a company is to find out the secret of how can I improve that to really get a real adoption. It's not only does it answer to a need, yes, is it available, is it cheap enough, etc., is it the law favors it, adoption, etc., but also sometimes the way we are wired as people. We may think we need it, but the way it's presented, maybe we don't use it at the end because it makes us feel old or it makes us feel whatever. So these people that are able to translate that are a key point, and that's what I think we're trying to find in our Living Labs. I think, sorry, I talked too much also, but I think it was important. So I really enjoy all your presentation, and I like what sorry, the Shapes project girl. Sorry, I don't remember the name.
Neve. Sorry, I should change my name.
Apologies.
No problem.
This is very important. Yeah, what you said of the data. I mean, it's really like even we struggle in this project, like to be able to share the data in a more, of course, protecting. This is for sure beyond question. But we are sometimes blocked by not being able to share the outcomes in a more flexible way, because if not, we might be repeating mistakes or we might be, encountering the same barriers. And this is so important to share, being able to share some kind of contacts or some kind of profile stakeholders or associations or ways to go or strategies. And I find this is difficult. And because we know each other and that and we are able, but Magdalena said that not everybody gives value to joining international collaborations. We do give a lot of value on that. So yeah, I'm glad Magdalena does it as well. But it's important, this data. I don't know which is the best way to share. Of course, everybody has to be protected, their data, absolutely. No doubt on that, but there must be a way. So we also have to improve that, I think, in European projects in general. So thanks, Neve, for bringing it up.
Okay, so I don't know if Javier, if you want to add just a very quick comment before we go on to, because we have two questions, I think, from Anupoma and from Oscar.
Yeah, thank you very much, Claudia. Will be quick. I have two answers to Giuseppe and Gisela. To Giuseppe, I like very much the concept of Living Labs. So of course, they are very near to different kinds of stakeholders. I do wonder if we are still accessing or having access to the people that are less connected, that have lower opportunities to participate a little bit more either economical or socially disconnected. And also, let's don't forget, because Gisela, you also mentioned that also stakeholder and users are participating. Don't forget that we are, with all the respect, we are in a kind of European Brussels bubble, of research bubble. We are not connected very much to the older people and users, to the citizens in general of all ages. So we really need to bridge those these distances as well, yeah. And also, Gisela, you mentioned, and this will be very brief, you mentioned that all kind of stakeholders are participating, and I do consider, I'm talking about funding, and I'm thinking about investors, payers, and buyers, and they do also have challenges and different needs and requirements. So knowing all these needs from the very beginning in the projects we are developing will be very helpful towards a sustainable and a good result from the economical point of view. Yeah. So I do also think, and I wonder if they are also involved in all these processes. Thank you very much.
I don't know if I can react.
Yeah. Very quickly, please, for Anupama to ask his question.
Or otherwise others, so I don't want to be, but if you mentioned, so
go ahead. I wanted to react also. Go ahead.
Okay, so after you, Gisela, after you, please.
No, I was the answer number one. We do have a committee, expert committee within CSG that is participating in along the project, and they include investors, payers, they include society in general at different levels. So the answer in our case is yes, we do have them involved, but I'm sure we're missing some. I'm sure, but we do.
Very good, thank you.
Giuseppe, your turn to react.
Yes, I forgot the second question, but for the first one, it's never enough, Javier. That's what we have been discovering. So to really bring the people that are excluded from several type of innovation. So using inclusiveness theory and approaches and having ethics as the driving force for all the activities of our projects is what we are doing. And again, I tell you the experience of the ActiveAge project in Madrid. In Madrid, there is many other places, but I'm aware of Madrid and actually also Hong Kong. We have done a twinning with the Hong Kong region. The rate of suicide of older adults is astonishing. There is a lot of social isolation and not access to many services from many target end users. How we achieve this type of partners with the Living Lab approach, interacting with the service provider, NGOs that are serving this type of person. So that was fundamental for us to learn about what you have been saying and try to achieve also this target adult. One of our use cases was about social isolation, and the people at risk of social isolation is also depending sometimes of the social level. So, and then another thing that we did through this organization and service providers, we organized an event in our university with 200 people that were coming here. We take 4 buses, took these people from several places over the city, and they came to our university to see our technology. The event was called Dia de la Felicidad, the Day of Happiness. We were trying to explain with professionals, but also other persons, why it is important to be happy. It was not a trivial message. Very, very important and moving day we had. And this was an event for us to learn more than for the others to learn. So that was something that we really did, and we have videos, we have material, so we are happy to share this experience with all of you.
Okay, thank you, Giuseppe. Now moving on to the Q&A with the audience. Anupama, do you want to kickstart these questions?
Thank you so much. I am Dr. Anupama Hock from Austria. First of all, thank you very much to the presenters. It's been really, really helpful, bring out a lot of issues. What I want to ask about is that first a comment and then a question. In the past 15, 16 years, I have been tracking different health technologies and really fantastic innovations, which were good as ideas. However, a lot of them died out because they just couldn't survive in the business market. And this is where I see the disconnect, that the innovators come up with really good ideas, even prototypes and products, but then we as a system kind of throw them into the sea and tell them, now you go survive. Yeah, your idea was good, but now you go survive. And that's why a lot of them die, because their innovators may be really great with coming up with solutions, but selling, marketing, branding is not their strength. However, a stark contrast is, and here I will give a very specific example, metformin, a diabetes management ingredient which has been around for decades. All you have to do is take the metformin, make a slight change into the chemical structure, give it a good name, and voila, you have a new product. It is accepted and it is reimbursed by all the health insurance companies or whatever payer scheme that you have in your country. It's completely opposite for these other solutions, and especially digital health management solutions. So my question is, could we come up with a body who actually move at the pace of innovation speed? Because innovation speed is lightning, and policy and this kind of policy relevant bodies move with the speed of a tortoise, which is not at all helpful. Can we make a body who actively seek out new innovative solutions which are effective, safe, ethical, and then make sure that once it passes our standard of evaluation matrix, it is enlisted just like any other drug, so that doctors can prescribe it, patients can use it, and it is reimbursed. Therefore, have a better chance of surviving. Can we come up with that? Thank you.
Thank
Nobody
you.
talks, I will answer, but just tell me if you want me to answer.
Yeah. Now it's freestyle. Who wants to add, please
There
go
is
ahead.
somebody else, I will talk afterwards, so I don't want to.
No problem, no problem.
Well, thanks a lot for the great observation, Anupama. Well, but also in the metformin example, I also have some doubts. My mother has now diabetes. She's older, so she now diabetic, and she refused to take this medicine because she has some concerns for some reason. So also when with drugs, I understand your point, but you and I'm telling this not only as a son, but also as a member of the A1 group on adherence to treatment. So understanding the real elements that are needed in order to take the pill or the digital pill, let's put it in this way, is fundamental. Otherwise, things are not going to work. So really understanding what means empowering, what means activating our citizens is going to be fundamental. This is what we did in DRT now. Now, regarding the technology, of course, many of these technologies are and will be medical devices, especially with the new regulation that started 2 days ago. And there are many things that we need to comply in order to validate and certify all the elements, all the technological elements that we need. So in one side, there is the new regulation, even many things have to be defined yet. And there is also the new regulation on artificial intelligence that is also related with what we are doing. There was a report from Nature about the first 100 FDA-approved medical devices based on artificial intelligence. And basically, they are suggesting to create sort of observatories, digital surveillance of these products. So something that we are taking from the pharma economy and pharma sector. But for our tsunami of new devices, as I mentioned during my speech, we need to be aware that some methods that are coming from other the clinical economics and pharmacoeconomic sector will not work properly for our type of devices. Also, the type of study are different, maybe different. Not always the randomized control trial is the best trial for medical device. So there are several elements that we have to consider and that we are considering. So we have to certify we need to consider existing and new guidelines for health technology assessment. We need to include methods like multi-criteria decision analysis because it's a multidimensional evaluation of our technology. And then there is another element that for the failure of these solutions in the market that we have to consider. As I was saying before, many are technological based innovation, but always they are process and service innovation. If we are not conceiving them as a new service, my humble opinion is that we will fail. So in our projects, we are considering this type of innovation, and part of our DNA is the value-based healthcare approach. So we want to link our innovation into procurements, innovative procurements that our service providers and our payers may put soon after the Gatekeeper project. And there are some regions that are already doing this type of innovation. So the market is already there for our project. And therefore, linking evaluation to procurement and value-based healthcare may be a way to increase a little bit the possibility of success.
Can I just very quickly add? Thank you. We also have to understand that metformin 10 years down the lane will remain metformin. We really don't need to do a lot there once it is approved and being used. But the problem with the kind of solutions that we are talking about, they get upgraded, they get changed. So these products, you know, continuously change and upgrade. So there is I think there is a need for a specific department or a body which actively evaluates these products and makes it make sure that it is still effective, safe, ethical, and then maybe give approval so that these can be used properly at the user end. And I don't think if we put this responsibility to FDA or EMA, it's not enough. It's a totally different kind of work. They have to be really proactive. And we are so focused on products of curative medicine, but not at all on preventive medicine, which we need to focus on. And all these new solutions, digital solutions, has a lot to do with prevention. If we need to save money, let's save money by prevention. You know, that's why I'm saying that we really need a new body, new way of thinking, and new process of evaluating. Thank you.
I totally agree with you, and I think this is going to happen. Sure.
Okay, thank you a lot, Dr. Anupoma. I don't know if Oscar, if you want to pose your question, or Shariklia? Okay, Oscar?
Yes, please, Claudio, very quickly. My question is almost to the Shapes consortium, and it is about how they consider, or we could consider the influence that we could play towards policymakers when they are thinking about the conversion of building or places, considering such kind of solutions. Because we talked about awareness of them, but yeah, the question is if they consider methodologies or ways to improve this awareness around Europe. Thank you very much.
Hi, Oscar. Thank you very much for your question. And it's a very good question. I suppose one way we are trying to think about this in our methodology throughout the project is through our second open call, which will invite additional pilot sites into Shapes, so that we will be able to, when the platform itself is more developed and up and running, and we have already began our pilots throughout the sites within the consortium, start to invite additional sites in, test the pilot, see how it works. And I suppose to answer your question, we would like to illustrate that in our results and our feedback from these pilot sites. But more specifically, I suppose, and it relates back to the previous question, it's a very good point. There's a lot of amazing innovation and technology in all of these projects around older people and aging. And the biggest concern I think a lot of us have is that at the end, that is it. It is left on the shelf as an amazing project with amazing resources, and great expertise, but that it's not adapted. So I suppose in shapes, we are really trying to consider the local and regional healthcare systems, so that, for instance, in Ireland, we have the health service executive, okay, and they will have their own computer systems. We don't want to come in and say, overhaul everything and go straight to shapes. We can offer you everything you want and solve all your needs. What we would like to be able to do is find specific areas in the healthcare system where shapes can be adapted into in a seamless way. So maybe you have your own system there, but actually we can use your authentication and that can link directly into the Shapes platform in a very seamless manner. It helps you as a healthcare professional, and it's very simple for the user too. So I suppose briefly, we want to show the proof in the pudding at the end of Shapes.
Thank you very much for your answer.
Thank you.
Thank you, Niam, once again. So now for the last question, Chariklia, do you want to pose your final question?
Yes, thank you. I actually have by now 2 questions. Thank you very much, Claudia.
Okay, the final two, then it's fine.
It will be very fast. You know, I was born in Crete and educated in America and had all my academic life been there and worked within the FDA world. I don't remember having these kinds of barriers about technology not being adopted. I'm wondering if there's a variable here that we are missing out on. I'm going to think about that question, but I recommend, as Giuseppe mentioned about the FDA. FDA is regulating things, including AI algorithms, because they're medical devices. And still, the market is going crazy. Why are we having a problem in Europe? I don't know the answer, but I think it's worth for us to think about it. But my question was the following, and again, biased about it. All these technologies and the living labs are in the big cities. I would love to ask the experts that are present here, how, if you came to my little village where I was born in Crete, where the Wi-Fi is really bad, and where the mayor really wants to improve preventive kinds of things for the older people who are left behind because the young go into the city due to demographic change. What can we do in that region? Is the demand there high enough that the technology will be diffused in there? Do we have the technological 5G kinds of connectivity? Those are the questions that I personally am interested in from the point of view that that's a demographic change is going to continue. These people are marginalized. They need help. Maybe they will be more accepting of these technologies. I'm saying that based on a pilot that we did in a small village in Crete. Obviously, I know the people because they raised me, but I honestly think that that's a question that the living labs are in the middle of a different world than what the periphery has to offer. I would love to explore that area with those interested and love to hear the reactions of people who work in those regions. Thank you.
If I may answer and jump before the silent, I will invite you to Galicia. We actually have a rural living lab. This is a very dispersed area. So our living labs are dispersed. And we have probably more problems than Crete with connectivity. In fact, right now I'm in the middle of the nowhere in front of the sea, but still we manage to have connectivity, not with some problems, but we do have rural living labs, because otherwise for us cities in Galicia would be a big bias. So yeah, if you want to experience rural living labs, I invite you to Galicia.
I will come because I know Galicia anyway, but yes. I will come to see how you did it, because where did you get your funding from? The point I was trying to make from the mayor in the places, the local government is seeking this service. They're seeking it, they want it. So, but it's not there. We can give it to them. So it's that kind of demand. If you look at the model of supply and demand, the issues that were brought up today were so meaningful to me, because I have seen them, experienced them, I understand them, but there's some wonderful technologies. I was a reviewer for the gatekeepers project in these new technologies. I love learning about these technologies. I say to myself, why are they not widely taken up? What is the issue here? I heard answers here in the debate, but I'm not really sure that we have nailed down the issue of why. I don't think that in my head, I still have questions. When I compare it, why is China not having that problem? Why the US is not having that problem? What is the issue here? I don't see a clear answer. I'm not an expert, but I am saying, okay.
No, for sure, we need a capillarity here. A big backbone that we have to deliver technology is precisely our healthcare system, more than our social care system, but more the healthcare system. And the capillarity is achieved by the rural pharmacies, which also have this connection people to people, because it's not only technology. You must have a trust between the people. So actually, pandemia has really exacerbated that. And then the fortunate ones that now we can remotely work. We can remotely work from a beautiful countryside house. You know that, but you see this capillarity and through the police. Actually, it happened during pandemia, but day to day, still it happens through the rural pharmacy that is completely set into the integrated interoperability system, and then it's able to talk the same language. So they know about technology, but then they talk the language with the people, and you have to think that most are over 80 years old here, so we have like
right exactly.
In addition to that, but
thank you so much.
But please, I really honestly invite you. So please feel free to contact.
I will be in touch somehow. I'll find your email and be in touch.
We can do that connection as well, Sharika, if you want to.
Thank you very much, Claudia. I really think that the pharmacists are a key element. I've seen it in reality. And I believe it, including in America, the rural areas, the pharmacist plays a key role in many ways. Thank you.
Yeah.
Claudia, has been a wonderful web seminar. Really learned a lot.
Thank you, Sharika. I don't know if Giuseppe or anyone wants to add just a final comment to this issue of connectivity, the capillarity, if there's something that we are maybe as a community and as a region not doing well in this regard.
Yeah. Try to be synthetic, but in the Activate project, Galicia was one of our regional involved in the project. So we also experienced that, and they were working with the Red Cross. So that actor was fundamental, because this is the actor that is the connector, the real connector, independent on the connectivity issues that you may have. Through them, they were reaching trust with all their adults.
There you go.
In Gatekeeper, we have also several regional healthcare systems, and this means that within these regions we have the same type of issues. So, from one side, you have to adapt to the reality and to the territory that you are going to have your innovation. And again, I see many discussions here about innovations that work in the US. But as I also learned in my PhD, they are working in the US because the technological based innovation work in the US. In Europe are not working because our system is different and innovations are always linked to a service. So they are working better in Europe, in my humble opinion. This type of, my humble opinion, there were reports saying that about this type of innovation. And this means that the living lab approach again is fundamental, because it's really creating something that is very dynamic and you learn by doing. And also it's true that the pandemic has enabled some technological push. And we have been talking, some of our pilots are already using technological platform to achieve their patients within the pandemic. And the other element is that being a technical manager of such a big project, I'm now talking with several regional healthcare systems and authorities. And when I mention them, the living lab approach and the reference site collaborative networks, for instance, so to really work as a system, that's the way whichever region or area in Europe can really achieve and have better usage of funds for doing innovation in their territory. So these are the type of elements that I am also observing that makes the difference also when we talk with the policymakers.
The local policymakers, not just
Yes,
the
the
top.
local. I'm referring
Exactly.
to the local ones.
Yes.
When I mentioned to the local policymakers, what we have been doing in the last 10 years in the IN-4-AHA, they were, and they wanted to be there because this is where we learned a lot of things. So local, but looking at the experience that we have in Europe, and then try to really work as a team to get better usage of the funds that many of these regions already receive. So sometimes it's a matter of using in a better way this type of funds.
Yes, I agree with you on that. That's a very interesting point that you make, because we face that issue in Crete, that the community of the little town has a mayor who only if somebody would explain to him would he know how to. They would love it, but somebody has to tell them about it. So the local government seems to me to play a key role. It's almost like the pharmacist, so to speak. But we need to educate them. We need to reach out to them, not the other way around. I agree with you very much, Giuseppe, and I hope that we will find a way to do that effectively. I know Magdalena is still here, and we'll work to get to the local authorities. Thank you very much.
Thank you, Jenny. Thank you.
Thank you. I don't know if there's a final comment in Javier. Do you want to add something?
If I may, Claudia, I would like to add something. Coming back to the comment from Anupama, I do really agree that the USA is much more, has a completely different culture on innovation and investment. And I would like to link this to the fact that many of our research projects are not coming to the market at the very end. And we need to think about why. So if we are doing co-creation with end users and different stakeholders, and at the end of the project or just 1 year before, we realize we need to change something, but the project structure does not allow to perform another extra year, although perhaps one region somewhere in another country says, well, if you continue developing that, I give you, I don't know, something, and please extend 1 year, include us there, we want to participate. So making these structures more flexible so that in between additional funding is coming so that we really can make it to the market might be a possibility of change, because otherwise we are stuck to 1, 2, or 3 years time. The budget is closed and we cannot change that. We cannot involve people. We cannot change the concept. Add another phase, we are stuck. That would be my comment. And also, please, sharing ideas. I'm sure in USA, people are sharing also much more the ideas. Yeah, so not only keeping it regionally or in the city, but spread it, share it, so that other people can bring you eventually a solution. Matchmaking on that also is very necessary. Thank you very much.
Okay, thank you, Javier. Really now, I mean, we're kind of pushing the scheduling here. I was planning on 3:15. We're approaching 3:30, so it's a bit long in the tooth. So I'm gonna have to close this webinar. So first of all, thanks a lot to everyone who participated. Thanks to Giuseppe, to Javier, to Niam, and thanks to everyone who asked questions. Thanks for Elisio as well, Gisela and Kaya, which are also from the IN-4-AHA consortium and who gave a big help here. So from our side, the only thing that I want to add is that you're going to be receiving a follow-up package. So everyone who signed up, even those who have left early, you will receive the follow-up package with the full recording, with some of the notes taken from this discussion, and with all of the PowerPoint PDF presentations. So please do, if you want to further this discussion, reach out to us. We can still make some bridges. I think that Gisela and Chariklia, we're already making that bridge. If you want to make that bridge in the chat, so be it, because the chat is also going to be copied and then presented with the meeting notes. So if you want to leave a contact there, please do leave a contact there. As I'm just closing in on this, I'm going to stop the recording in a few minutes. So thanks a lot for participating. This was a very dense discussion. I think was very deep and very good for us to have. So thanks a lot, everyone, and have a nice weekend. Have a nice rest of a Friday. And we'll keep in touch, and we'll keep having these webinars and these wonderful conversation spaces. So thanks a lot.
Thank you. It was wonderful. Really, thank you.
Very much.
Thank you very much, everybody.
Have a
Enjoy
great
your
weekend.
weekend.
Bye-bye.
Bye.
Bye bye.